Mhm. Hey, Lucky, a couple of quick questions
Sure.
that came in on the chat while you were speaking. I think quite a few of us were surprised about the fact that the ovaries don't actually just hang. Is that something that can change over time as you age, or is that generally how it is when you're born? And then also you mentioned what happens when you have a pap smear. How often would you recommend having a pap smear?
So those are really great questions. Um, so the reason I mentioned that thing about the ovaries is because when women are coming to me for egg freezing or IVF, a lot of them worry about how are you getting the eggs out? And we talk about, going through the vaginal wall with a long thin needle while they're asleep so they don't feel anything and it's a very minor procedure. But it's not a high risk procedure and it's really easy because the ovary is just hanging out right against the vaginal wall. And that's why it's important to make that distinction because otherwise people think you're traveling all this distance and that's kind of dangerous because there's all these other structures and blood vessels when in reality it's super easy to access. I also think it's important to understand because people get very anxious when, are having sex and they feel like a twinge or a pain and sometimes it's because when you're ready to ovulate one of those eggs, they're all housed in these small little bubbles of fluid called follicles. A follicle expands and gets much bigger, and it has to rupture and burst, and it releases fluid, which can be very irritating to the lining of your pelvis. And all of this is happening right next to the vaginal wall. So if you're about to ovulate and you're having penetrative sex, that can be painful, or you might feel pain, during that process. And it doesn't mean necessarily that something is wrong, but that extra sensitivity might be accounted for by the fact that you are ovulating and that ovary on that side happens to be enlarged. So I think it's just important to really understand what's happening with the internal anatomy because it helps explain some of the symptoms that women experience. The other question that you asked me was about pap smears.
Yeah.
So, pap smears used to be recommended on a yearly basis, and then public health experts in the last decade or so said that it was safe to, in low risk women who have had mostly normal pap smears or at least a few consecutive normal pap smears in recent years, can space out the interval to like every 3 to 5 years. Now, we know that cervical cancer or the early precancerous changes that can happen to the cervix are mostly caused by a virus called human papillomavirus or HPV. HPV is everywhere. It's not a sexually transmitted disease. And it is something that most people have been exposed to, and your immune system can clear it. But sometimes it will evade your immune system. And if it lingers around long enough, it can transform the cells on the outer part of the cervix. But it's not going to happen overnight. So it's not something that you need to worry about if you've been told that you have HPV. We know that cervical cancer type changes in cells take 10 to 20 years in most cases to develop, which is why cervical cancer, it is becoming exceedingly rare, thankfully, because people are really up to date on their pap smears. And if you find some abnormal cells, now they have really uh, non invasive or minimally invasive ways to just remove those problematic cells and then just kind of keep surveilling it and making sure that you're not letting it go too far. So pap smears at a minimum every 3 to 5 years. If you have known abnormalities, maybe it needs to be every year for you. So that's something to talk to your GYN about.